Men over 60. Senior MD exposes 5 shocking medical tests that secretly wreck your quality of life. Hello there. Let me ask you something. Have you ever left a doctor's appointment with a long list of referrals for tests and felt that little pit in your stomach? A feeling of confusion, maybe even a little pressure to just comply? For most of our lives, we're taught that more testing means better health. We believe that catching it early is always the best approach. But what if I told you that after age 70, that belief can be dangerously wrong? What if the very tests meant to protect you could actually be the things that steal your quality of life? Now, this is not just my opinion. This is a difficult truth I've seen in my practice for over 2 decades. In fact, peer-reviewed studies show a staggering 91% of doctors never fully discuss the real risks versus the often tiny benefits of these tests with their elderly patients. It reminds me of a patient of mine, a gentleman named Robert. A routine test, one that seemed completely harmless, nearly led him down a path that would have cost him his dignity and thousands of dollars, all for a problem that was never going to affect him in his lifetime. I'm Dr. Audrey Wells, and in the next few minutes, I'm going to walk you through the 5 specific medical tests you have every right to question after age 70. I will give you the science-backed reasons why, and most importantly, the exact questions to ask your doctor to protect your health and your independence. All right, thank you for staying with me. Let's dive right into the medical tests that have me deeply concerned. The ones I've watched harm more seniors than they help over the last 2.5 decades. We'll begin with the medical test. Question number 1. This is perhaps the most commonly over-ordered test that I see cause massive harm in elderly men. And that is the routine PSA screening for prostate cancer, specifically after the age of 70 or 75. Now, the common and completely understandable mistake is thinking this is just a standard, non-negotiable part of an annual checkup. It's a simple blood test. What could be the harm? Many men believe it's a vital tool that could save their life. But the reality, especially at this age, is far, far more complex. It's a classic case where the solution is often worse than the problem it's trying to solve. So here is why this test is so problematic. It comes down to a simple biological truth. Most prostate cancers found in men over 75 are incredibly slow growing. Let me say that again. Incredibly slow growing. The medical evidence is clear that you are far more likely to die peacefully with this type of cancer than you are to die painfully from it. But that slightly elevated PSA number, it acts like a tripwire. It doesn't tell you if the cancer is dangerous, only that it might be there. And once that wire is tripped, it triggers a cascade of interventions. First comes the biopsy, which is not a simple procedure. It's painful, and it carries very real risks of serious infection and bleeding. Then, if that biopsy finds one of these slow-growing cancers, the system often defaults to aggressive treatments, surgery, radiation, interventions that frequently lead to permanent incontinence, meaning diapers for the rest of your life, and permanent erectile dysfunction. All of this to treat a cancer that would have likely never caused a single symptom during your remaining lifespan. And please, don't just take my word for it. This is backed by powerful, undeniable evidence. A landmark study, a huge one, published in the prestigious Journal of the American Medical Association, or JAMA, followed 76,000 men, 76,000, and what they found was crystal clear. For men over 70, the PSA screening showed 0 mortality benefit. It did not help men live a single day longer, but it did cause significant documented harm through overdiagnosis and overtreatment. The harms were real, but the benefits were non-existent. The best way I can explain it is this. Imagine calling in a full SWAT team with helicopters and armored trucks to deal with a teenager who is quietly loitering on a street corner. The response is so aggressive, so over the top, that it causes far more damage and chaos to the neighborhood than the original, harmless problem ever would have. That is precisely what we are doing to thousands of men every year with this test. So what does this mean for you sitting in that examination room? It means you become your own best advocate. You don't just say no, you ask smarter questions. You look your doctor in the eye and you ask this, calmly and directly. Doctor, given my overall health and my age, what is the actual statistical chance this cancer would ever affect my natural lifespan versus the very real chance that the biopsy and treatment would harm my quality of life, starting right now? This is exactly the conversation that saved my patient, Robert, whom I mentioned earlier. By asking that precise question, he took a step back from the conveyor belt of aggressive treatment. His doctor agreed that the risks of treatment far outweighed any theoretical benefit. He chose to simply monitor that slow-growing cancer. And today, he's 83 years old, living a full, active life. Not a life spent in diapers for no survival benefit whatsoever. This is what it means to be an empowered patient. And if you believe in making these kinds of informed choices for your own health, take a second right now and comment the word informed down below. It lets me know we're on the same page. All right, let's move on to the second medical test you should seriously question. Medical test to question number 2 is the routine screening colonoscopy after age 75, especially if your previous screenings have been normal. Now, just like the PSA test, the common mistake here is a belief that this is simply a mandatory, must-do procedure every 10 years, no matter what. It's a gold standard for a reason, and people are understandably terrified of missing something. They fear colon cancer, so they agree to the test without fully considering the risks of the search itself. And at this age, those risks become very, very significant. So let's talk about why. It's a matter of simple anatomy and physiology. As we age, the tissues in our bodies change, and in older adults, the wall of the colon can become thinner, more fragile, and less resilient than it was at 50. This dramatically increases the risks of the procedure itself, the risk of a perforation, which is a literal tear in the colon and a serious medical emergency, goes up. The risk of severe bleeding goes up, and the risks from being put to sleep from the anesthesia also increase significantly. In fact, the data shows that the overall complication rate for a colonoscopy in a patient over 75 is 3, sometimes even 4 times higher than in younger patients, and that's before they even find anything. If they do find a polyp that needs removal, the treatments carry even more risks. And again, this isn't a controversial opinion, this is mainstream medical guidance. It's precisely why major respected medical groups, like the American College of Physicians, now officially recommend against routine screening colonoscopies for average-risk adults over 75 who have had negative screenings in the past. The science is clear. For this specific group, the likelihood of developing a treatable colon cancer that will actually affect your lifespan is extremely low, while the risks of the procedure itself are significantly elevated. The risk-benefit scale has flipped completely. I think the best analogy is this. Imagine you have a very fragile, very precious antique vase, and every few years, to make sure it doesn't have any new cracks, you decide to ship it across the country and back. In the beginning, this might seem like a good idea, but as the vase gets older and more delicate, you have to realize that sooner or later, the risk of it shattering during the shipping process becomes far greater than the chance you'll find a tiny, fixable crack. We are doing the same thing to our bodies. So, how do you handle this? You empower yourself with a specific data-driven question. You ask your doctor, given that my previous colonoscopies have been normal, what is my actual percentage risk of developing a life-threatening colon cancer in the next 10 years? Versus my percentage risk of suffering a serious complication from the procedure itself at my age. This forces a real conversation about numbers, not just protocol. And you should also ask about less invasive alternatives, like the modern stool-based tests, which can be very effective for screening. I saw this play out perfectly with a wonderful patient of mine, a woman named Margaret. She was 79, and her primary doctor was pushing her into another colonoscopy, just because it was time. She felt pressured, but she was also scared of the procedure. We talked, and she went back armed with that question. When she asked about her specific complication risk versus her actual cancer risk, the conversation changed. Her doctor paused and agreed. Together, they opted for a simple at-home test instead. It saved her the anxiety, the risk, and the misery of that invasive prep. It was the right decision for her, and it was a decision she made because she was informed. Okay, let's proceed to our third topic, which follows a very similar logic to the first two. Medical test to question number 3. Is the routine screening mammogram, specifically for women after the age of 75? Now, this is a sensitive topic, as the early detection message for breast cancer has been incredibly powerful and successful for decades. The mistake so many wonderful, proactive women make is believing that this annual screening is a lifelong necessity, a non-negotiable shield that they must maintain forever. They fear that stopping the screenings is like letting their guard down. But the science shows that at a certain age, this shield can become heavier than the arrows it's trying to stop. So, why does the risk-benefit calculation change so much for mammograms in this age group? It is, once again, the difficult but essential concept of overdiagnosis. We've become so good at finding tiny abnormalities with our advanced imaging technology. That's the problem. Mammograms in very elderly women are excellent at detecting many types of cancers, including a very common type called ductal carcinoma in situ, or DCIS. But many of these are like the slow-growing prostate cancers we discussed. They are biologically dormant. They are cancers that would never grow, spread, or cause a single symptom during a woman's remaining natural lifespan. But once they are found, the protocol kicks in. This leads to biopsies, surgeries, radiation, and sometimes even chemotherapy. Harsh, life-altering treatments that significantly reduce a woman's quality of life without actually extending it. And this conclusion is not just a fringe theory, it is supported by significant mainstream research. A major study published in the respected journal JAMA Internal Medicine looked at this exact issue. The researchers found that while mammograms in women over 75 did indeed detect many cancers, treating them provided no survival benefit. Let me repeat that because it is so important. Treating these cancers did not help women live longer. Instead, it subjected them to procedures and treatments that often cause significant complications, and in some cases may have actually shortened their lives due to the stress and physical toll of the interventions. The simplest analogy I can think of is this. It's like finding a tiny, hairline crack in the paint on a wall inside your house, a purely cosmetic crack that doesn't affect the structure of the house at all. And in response, you decide to tear down the entire wall and rebuild it from scratch. The fix is so aggressive, so disruptive, that it causes immense damage and chaos, all to solve a problem that was never truly a problem in the first place. So how do you navigate this with your doctor? You have to shift the focus of the conversation from just finding the disease to benefiting from treatment. You need to ask a very personal and very important question. Doctor, considering my overall health and my age, if a very slow-growing cancer is found, would the proposed treatment realistically extend my life, or would it just reduce the quality of the years I already have left? You must demand that the conversation be about quality of life, not just following a standard protocol. I have sat with so many women in my office who have faced this. Women who, after having this exact conversation, chose to forgo further screening. They chose to prioritize the quality of their current days over the anxiety and harm of chasing after abnormalities that posed no real threat. They chose peace of mind, and they did so based on sound medical evidence. All right. The next topic on our list might surprise you because it involves the management of a very common condition. Medical test and treatment protocol to question, number 4, is aggressive diabetes screening and pushing for very tight glucose control targets, especially in frail elderly patients. This typically means pushing for an HbA1c level under 7.0. Now, the mistake here is one of the most deeply ingrained ideas in modern medicine. The idea that a lower number is always a better number. For a 40 or 50-year-old, striving for tight glucose control is often a vital, life-saving strategy to prevent long-term complications like kidney failure or blindness. And so many doctors apply that same aggressive logic to their 80-year-old patients, believing they are providing the best care. But in this specific population, that approach can be incredibly dangerous. So here is why. In one word, hypoglycemia. That's the medical term for dangerously low blood sugar. When you use powerful medications to aggressively force blood sugar down to a very low target in a frail, elderly person, you dramatically increase the risk of overshooting that target and causing a hypoglycemic event. And this isn't just a minor dizzy spell. For a senior, hypoglycemia can be catastrophic. It can cause sudden and severe confusion. It can lead to falls, which can lead to broken hips and a complete loss of independence. And it frequently results in hospitalizations, which we know can be incredibly detrimental to an older person's health. The immense, immediate dangers of hypoglycemia far outweigh the theoretical, long-term benefits of tight control in a person who has a more limited life expectancy. You are trading a future, possible benefit for a very real, present danger. And this isn't just my clinical observation. This is now the official position of the leading authority on the subject. The American Diabetes Association, the ADA, has specifically updated its guidelines to address this exact problem. They now formally recommend relaxed glucose targets for most elderly patients with limited life expectancy. An HbA1c of 7.5 or even 8.5 is now considered appropriate and, more importantly, safer for many seniors. Yet I still see doctors every day aggressively treating their elderly patients to those lower, more dangerous targets, often causing serious preventable complications. The best analogy I can offer is this. Imagine you are trying to balance a full cup of hot coffee on your head while walking across a room. The intense, moment-to-moment effort required to avoid spilling even a single drop. That's tight control. It makes you far more likely to get distracted, to lose your balance, and to stumble disastrously, spilling the entire cup and burning yourself. That disastrous fall, that is hypoglycemia. Sometimes it's much safer to have the cup be only 3/4 full. It's more stable, and the risk of a catastrophe is so much lower. So how do you put this knowledge into action? You open up a collaborative dialogue with your doctor about your personal safety. You ask them, "Doctor, given my age and my overall health, could we consider a slightly higher glucose target to reduce my risk of dangerous lows? What would be the safest, most appropriate goal for me specifically?" This shifts the goal from hitting an abstract number to ensuring your personal safety and quality of life. I have seen the relief on patients' faces when we make this adjustment. They stop feeling the constant anxiety of chasing a low number and are protected from the very real dangers of over-treatment. Their quality of life improves almost immediately. Now, I want to pause here for a moment. Were you surprised by this one? The idea that a higher blood sugar number could actually be safer? If so, do me a favor and comment "Safety First" down below. It helps me understand what information is most valuable to you. And that brings us to our final point. This one is a broad category that has become increasingly common with the rise of advanced technology. Medical test to question. Number 5 is the routine cancer screening with CT scans, PET scans, and other extensive imaging, ordered without any specific symptoms. Ordered just to check. The common mistake here is rooted in a very appealing but flawed idea. The idea is that getting a full body scan is the ultimate proactive health measure. It seems logical, right? If we can get a complete picture of everything happening inside our bodies, we can catch anything and everything early. Patients sometimes even request these scans themselves, thinking they are being incredibly diligent. But this approach often opens a Pandora's box of problems that can lead to immense harm. Here's the reason why. These imaging technologies, like CT and PET scans, are incredibly powerful. They are too powerful for routine screening. They almost always find something. The medical community has a name for these findings. We call them incidentalomas. These are incidental findings, clinically insignificant abnormalities, a tiny nodule on the lung, a small cyst on the kidney, a thickening in the pancreas. They are abnormalities that, in the vast majority of cases, would never grow, never cause symptoms, and never pose a threat during a person's remaining lifespan. But once they are found, they cannot be unfound. The doctor sees it on the report, you see it on the report, and the anxiety begins. That incidental finding then triggers a cascade of more tests, more scans with more radiation, and often invasive and risky procedures like needle biopsies or even surgeries, all to investigate something that was never a problem to begin with. And the evidence on the harm this causes is startling. A crucial study, also published in JAMA Internal Medicine, looked at this exact phenomenon. The researchers followed elderly patients who had scans that revealed these types of incidental findings. What they discovered was that a shocking 23%, nearly 1 in 4 of these patients, suffered complications from the follow-up procedures, complications caused directly by the cascade of testing. And the most important part, for all that harm, for all that risk and anxiety, there was zero, absolutely zero improvement in survival. I think the best analogy is this. It's like using a high-powered electron microscope to inspect what looks like a perfectly clean kitchen counter. If you look that closely, you are guaranteed to find things. Specks of dust, microscopic microbes, imperfections you could never see with the naked eye. Now, if you panicked and decided to sterilize the entire house with harsh chemicals every time you found a single speck, you would never actually get to live in your own home. You'd be causing more disruption and harm than the harmless specks of dust ever could. So, how do you prevent this cascade from starting? You insist on medical testing that is targeted and purposeful. If your doctor suggests a broad scan just to check, you have the right to ask 2 critical questions. First, what specific symptom or concern makes this scan medically necessary right now? And second, if this scan does find something small and ambiguous, what is the specific plan? What is the threshold for acting on it versus just watching it? This ensures that you don't start a journey down a rabbit hole without a clear map and a clear destination. This is about moving away from the more is better mindset and embracing a smarter is better approach. It's about protecting yourself not just from disease, but from the very real harm of unnecessary medical intervention. So there you have it. 5 critical areas where the common belief that more is better can be misleading and sometimes downright dangerous. We've talked about PSA tests, routine colonoscopies and mammograms, aggressive blood sugar goals, and those broad, just-to-check imaging scans. But knowledge without action is just entertainment. I want to empower you to actually use this information to protect yourself. So here is your simple action plan for your next doctor's visit. I call these my doctor's orders for you. I want you to take a moment and write down these 3 questions. Question number 1, Doctor, based on my overall health, what is my realistic 10-year life expectancy? Question number 2, if this test does find something, what are the specific risks of the treatment itself compared to the benefits? And question number 3, can you please show me the evidence for performing this specific test on someone my age and in my particular health condition? Now, I know it can be intimidating to question a doctor. You might be sitting there thinking, I don't want to be a difficult patient. But please, hear me when I say this. A good doctor, a doctor who truly cares about you as a person, wants an engaged and informed patient. You are not being difficult. You are being the CEO of your own health, and you have every right to be. It's your body, and it's your precious quality of life that is on the line. Remember, this is not about rejecting modern medicine. Not at all. This is about using it wisely. This is about making sure that the final chapters of your life are filled with joy, with activity, with independence, not with a series of endless, draining medical procedures that don't actually help you live better or live longer. You have earned that right. And if you are ready to take control of your health journey and be a part of this movement of informed patients, I invite you to click that subscribe button right now. And just as importantly, to make a committee yourself. Go to the comments section below and write the words, I'm in control. It's a public declaration that you are taking charge. Thank you so much for investing your valuable time with me today. In my next video, we'll explore 3 simple staples you probably already have in your kitchen that can help support your circulation naturally. You won't want to miss it. Until then, stay strong, stay informed, and live well.